Right, now with a few hours perhaps to the launch of the much talked about medical drone service in Ghana, patients and medical doctors who have experienced the service are appealing to government to expand it to areas that grapple with access to emergency supplies. JoyNews' Matilda Wemega put the spotlight on the Tafo Government Hospital, which is the first of 2,000 facilities to benefit from this service across the nation.
Charles Kofi is the first person at the Tafo Government Hospital to have received emergency blood supply through the drone technology. Doctors operating on him on Monday had to call in for an emergency blood supply from the Zipline Center when they ran out of stock during surgery.
This service has really helped me. I am sure it will save a lot of lives out there.
So on to Woodia and the Ujida baby I say here, but so or two and who say near Omokan and Cray or say Ubua.
If you haven't experienced what I went through yesterday, you would easily criticize government for this intervention. It can do a lot of good to the people out there.
Nyokabani say baby omo pretty no a honor a discharge sir inti Dr. Janika say or say obi crew no washing inside in.
I was involved in an accident in Koforidua. The doctors performed surgery on me, but I had complications which resulted in me coming to this place. During the operation yesterday, I lost a lot of blood. This service has really helped me. I am sure it will save a lot of lives out there.
But for the timely intervention of the drone supply, anything could have happened to Charles.
All the force, they done the operation and they come out. But he alone is there. So I was worried. You understand me? Yeah. But we did a short time way, as so say this thing, that blind band, bring the blood before they took it and then go and operate my brother. Before my brother is alive right now. I thank God. But this one, it can help me and you. If it hasn't happy on you, you don't know say it's good. But if it's happy on you, you know say this thing is a very nice thing.
The Tafo Government Hospital took delivery of its first emergency blood on Monday during Charles's surgery. On Tuesday, they took delivery of vaccines for the immunization of children in the area. This is the first of 500 government hospitals within the Omenako-Suhum area in the eastern region to have benefited from the much talked about medical drone service.
The vehicle, maybe if the vehicle is going to convey the vaccine to us, maybe it will have broke down or something else. But as for the drone, I think it's good because it's faster than the vehicle as compared to the hours spent on going to bring the vaccines. Yeah.
Beyond the transportation cost and all that comes to you, what other benefit do you think this drone service is going to give this hospital?
Okay, the transportation, you have to forward the car and the person going for the vaccines and the rest. But as for the drones, I've seen that it dropped the vaccine and went away.
Medical professionals here tell me they get regular supplies from the regional medical stores in Koforidua, but usually it takes 3 to 4 hours to get supplies when they request. Flying a drone from the Omenako base in Suhum takes 30 minutes round trip. Director of Clinical at the Tafo Government Hospital, Dr. Eric Ansuoben says the drone intervention will reduce needless deaths recorded due to the shortage of essential blood and medicines.
There was a patient in theater who was hemolyzing. We needed FFPs, fresh frozen plasma. our labs can't offer it. But when we call the service, they were able to deliver in good time. And that patient is doing well now. It takes about 45 minutes by road to get to the medical stores. And you will need to make requisition prior to. Usually it takes more than a week to get your supplies. You can't request as and when. You will need to make projections and request according to your projections. But you know, emergencies do happen. In our field of work, there are things you can't predict. So when these things happen, medical stores can't supply because it has to go through procurement and a whole cumbersome process before you get the things from medical stores.
So within this area, is this the biggest facility here? How many people do you serve? Do you have a fair idea of the catchment area?
This is a newly created municipality. So formerly it was the second largest hospital in the district. But now we are the major municipal hospital. Okay. Yes.
What are some of the cases you see on regular basis?
We see surgical cases, we see mostly obstetric gynecology cases, we see medical cases, we see pediatric cases.
What are some of the things that you urgently need for some of your work here that it's sometimes difficult for you to get access to?
Blood, mostly blood. And you know, blood you don't get from... We don't get blood from medical stores. Okay. We do outreaches and get them. And the type of blood you might need, you might not get it. Okay. But with this service, they have a larger outreach with the National Blood Bank, and they can give us whichever blood we want and in whichever form you want it.
Okay, all right, sure. Any other thing you'd want to add with regards to this drone service?
I think it should be widespread as initially projected because it's helping us greatly. And I think it will also help a lot of district hospitals as it's helping us now.
Sure. The 4-year contract with Zipline, the company implementing the project, stipulates that the drone medical delivery service will make on-demand emergency deliveries of life-saving medications to over 2,000 health facilities across the country. Justin Hamilton is the head of global communication at Zipline.
We're 100% ready and could be more excited about launching this national drone delivery service with the government of Ghana. We think it's going to have a tremendous impact on the healthcare people receive across the country.
What should we expect from tomorrow?
Well, I think we're going to have a very large crowd here of distinguished members of parliament, members of the government, the ministries, the vice president, and we're very excited about the esteemed delegation that will come here and help us launch this groundbreaking service for the people of Ghana. So next, we'll be rolling out all 4 bases over the course of the year. Ultimately, we'll be serving over 2,000 clinics and up to 12 million people in Ghana. Okay. So we'll be able to deliver 150 different types of vaccines, blood products, and medications to people on demand and in emergencies just from this base.
Okay. This is the first of 4 drone centers that will be established here in Ghana at the Omenako Center here in Suhum in the eastern region. This facility is expected to supply emergency medical supplies to over 500 health facilities within the eastern region. We are told that in the coming days, 3 facilities will also be put up. One will be in the eastern region, another in the Ashanti, and then the northern region. For JoyNews, Matilda Pamaga, Omenako, Suhum, eastern region.